subject today is, as you well know, because you're here, and is healthcare innovation and impact on board oversight in 2016. And we have a panel that I think is absolutely perfect to address the issue. 2 nights ago, Wednesday, Beth Eby, who is principal at Eby Financial and the director of the development board at UIW, and 2 of her colleagues, I call them, Beth is tired of hearing me say this, but these are 3 women who have absolutely done extraordinary things for San Antonio and South Texas, called the Health Cell. They put together regular monthly programs and then once a year do the State of the Industry report, and that was in this hotel Wednesday night. I call the 3 women, Gabi Niederauer, Brigitte Glick, and Beth Eby, the Holy Trinity of healthcare. They really have been doing this for a long time, but only for a couple of years doing the State of the Industry. There were 5 presenters at that Wednesday evening, and many of you may know them. This was the program. Andrew Brenner, who's out at UT Health Science Center, CTRC, cancer therapy, has invented a device that you inject directly in the brain that reduces glioblastoma tumors. Just phenomenal. I lost a young brother-in-law to a glioblastoma about 7 or 8 years ago. There was no such thing. And then you think about, in that short a time, in just a matter of short years, right here in San Antonio, Andrew Brenner and a group of colleagues are developing a device, a medical procedure and tool that will eliminate the cancer. So he presented. By the way, did any of you go there, or have you been to the Health Cell and any of these experiences? Good, I see some have, so you know it. On the State of the Industry, it's kind of what I call TED Talks on steroids. You got 18 minutes at a TED Talk, but here Beth gives them 8 minutes to tell their story. So Andrew Brenner had 8 minutes to tell the story, and he was followed by Gene Patterson, who runs the immunology virology department at Texas Biomed, and is the leading expert on finding solutions for Ebola, among other infectious diseases. She runs the BSL-4 laboratory, among other things, out at Texas Biomed, where they wear the space suits and deal with the most deadly diseases that will all kill you if they get out. So she's figuring out ways not to let them out, but to kill them before they kill us. Alan Peterson was on the program and did his 8 minutes. He is running the PTSD department, if you will, at UT Health Science Center. And San Antonio has become the center for finding solutions for PTSD. Paul Castella on startup companies. Corey Hallam, who's out at UTSA, runs their department of entrepreneurship. Why am I telling you that? That's just by way of saying that Beth Eby and the Health Cell Holy Trinity put that program together. This one follows, I think, beautifully. And while we were thinking about the 2 programs, we were trying to link them for this as well. Well, who is Beth? Beth is the principal at Eby Financial, but she's a lot more. She used to be down in Del Rio, where she was city manager. She's worked for the NAD Bank. Was NAFTA helped to charter the NAD Bank, and she was there doing financing mechanisms for water and wastewater. She was the city manager at Del Rio following that horrific flood that they had. She's had a BA in international relations from the University of Pennsylvania, a graduate of Leadership San Antonio, and the governor's executive development program. She's the bright light in healthcare in San Antonio. She's a bright light, and she's a smart woman, and she's going to lead our discussion this morning with 2 brighter lights in healthcare. Dr. Byron Hepburn is a retired Major General from the Air Force. We are fortunate that he retired in San Antonio, and he is now the Director of Military Health Institute at UT Health Science Center. distinguished military career for 38 years. But before that, he was commander of the 59th Medical Wing. He led the Air Force's largest medical wing, more than 6,000 civilian and contract employees, residents, and students. He was Deputy Surgeon General of the U.S. Air Force, and in that role, he ran the Air Force Medical School, a little $5 billion, 43,000-person enterprise on integrated health care, serving 2.4 million beneficiaries, 75 military treatment facilities. We thought Don Cook had a big job at AETC. This former flight surgeon, pilot, and now doctor, and now director of our Military Health Institute for San Antonio, brings a very unique experience and expertise to our discussion this morning. And our second panelist is Dr. Jerry Wilmink. You see that beautiful woman who's on the cover of the magazine on your table. Iris is the spokesperson for Jerry's company, Wiseware. She is 94 years old, just a ball of energy, and represents Wiseware, which is a company Jerry created here in San Antonio. He is the chief executive officer of Wiseware. He started this company in his garage. How many times have you heard that? He found $4 million from some VC partners after exhausting every penny in his family enterprise, and started this company, which is now exploding on the scene. Most of you, many of you probably wear some kind of a fit measuring wellness tool. This one, I've just learned, needs to be replaced with Wiseware because I'm collecting germs on my wrist that's probably going to give me a rash. Jerry is a graduate of Vanderbilt. Got his PhD at Vanderbilt. His BS, his MS, and his PhD in biomedical engineering at Vanderbilt. But then that wasn't enough education. He had to go on to UTSA, where he got an MBA so he could figure out how to run a business. And that business is headquartered here in San Antonio, manufacturing this Wiseware, which is really jewelry. And he'll tell you a little bit more about what he's doing and the future of Wiseware. So with that background, let me ask our panelists to come on up. And Beth, I will bring you to the Queen's chair. Byron and Jerry, take your positions over there, and we will have a conversation. So please welcome them.
It's my great honor to know these two gentlemen professionally in San Antonio. I know them as doctor and general, but this morning we're going to try to go with Jerry and Byron, but I'm sure I'll slip because we're all friends here this morning, right? Very good. So healthcare is a very broad topic, and that's a good thing in San Antonio. We thought that what we would do this morning is put together a panel that kind of showcased some unique factors of San Antonio, some things that you couldn't read in the headlines about things like Obamacare and reimbursement and things. We may touch on those as well, and these gentlemen have expertise. But they work in sectors that are unique here, that are growing in importance in healthcare, and that present some of the greatest challenges and the greatest opportunities in healthcare. So these two guys have incredible stories. I could listen to them talk all day. We're going to start with a little bit of their background, then we're going to jump into some things that we think will be germane to your issues, and then we'll look forward to a robust discussion. So Byron, why don't we start with you telling us what it is that you're doing today?
So I've been at the university a little bit over a year now, and I have the honor of running the Military Health Institute, which is a new entity. It's a startup, just like Jerry's. Our university has been around for 40 plus years, and a lot of its initial founders were members of the military, all the services, and all the departments, all the schools, nurses, doctors, dentists, what have you, allied health professionals. So we've got a rich heritage of partnering with the DoD, but we're taking it to the next level with this institute in research, clinical care and education, collaboration, and there's an industry intersection here with our Office of Technology Commercialization, and we'll get to that as we weave the discussion. So that's the background.
All right.
Jerry?
I guess a quick bio. So my background's in biomedical engineering, and I came to San Antonio in 2007. And so that was through the National Academy of Sciences. Trained as an engineer, they brought me in to start a terahertz sensing laboratory. Terahertz sensing you've probably seen at the airports. Put your hands up in the scanning device. That's a millimeter wave terahertz scanner. So we did a lot of the bioeffects research for that, and then we developed a device for the military for BAMSI, the Brooke Army Medical Center, to use this device to pick up, or a burn surgeon could, if a troop comes in and they're flown in from Germany, put this on the skin, and it could tell the exact depth of injury of the burn and the severity and dehydration rate. So I did that for a little while, and then my world kind of changed. That's when we first met too. Is my grandfather passed away. He was basically my father. I lived with him for years, and he was really healthy, and he passed away after he fell in 2010. And so we started making a device which led to the formation of WiseWare, which was a medical device that is a hearing aid for seniors that allows a senior to hear, biosense, so dehydration rates, motion, gait, balance, and then tells them in real time, sit down, you're at risk for falling. And we got that started in my garage. Dr. Bennett Ivey and Dr. Elam and I. We got that started, and then I cleaned out my retirement account, and now we've made 5 or 6 different products, and we're all here in San Antonio. We have one office in New York City where our jewelry designers and all the really glamorous people live.
That's awesome.
Yeah.
Awesome. Byron, you got a couple slides you're going to show us about?
Just some background slides. And certainly this is not going to be paralysis by PowerPoint, but I think we have a number of individuals in the room that are from Houston and Austin, just to be aware that our UT Health Science Center really is, as the French say, a force motrice, a driving force for this sector. And we've got a synergy of activity at the university, 5 schools, dentistry, medicine, allied health professions, graduate school, biomedical sciences, and research centers and other institutes. So a very powerful force here. And that number there is not insignificant, $30+ billion, the broader healthcare industry. But you've got to have, every major city knows this, you've got to have a university complex at the core of this enterprise. And Jerry can back that up. So, but we're very fortunate here in San Antonio. We've got a synergy of synergies, and that alliance with the DoD. Other than Washington, D.C., this confluence of key military health assets is vital. You've got a level 1 trauma center at SAMC, the San Antonio Military Medical Center, Brooke Army Medical Command, essentially, on the east side of town. And what was a level 1 trauma center is now a state-of-the-art ambulatory surgical center over at Lackland Air Force Base, Wilford Hall. And then you've got a series of primary care clinics, and we can talk about that if we have time, is with a clear focus on prevention and integrated care with these major medical centers. But we've got partners of partners, and Jerry can speak to it better than I because he worked in that tri-service research laboratory. Some of it is classified research, but very important research for the nation. And over to the right, another mission partner is the VA with the Poly Trauma Center there. What's important about that is we have a lot of wounded warriors and veterans that stay in San Antonio, and we can do what's called longitudinal research. We can track the outcomes clinically for the decades ahead and also give them high quality care. So that's important too. And also for research, doing clinical research in that population. We train all the enlisted medics in the DoD here in San Antonio, Army, Navy, and Air Force. It's very powerful. And they rotate through our hospitals, so it's very important. The burn center that Jerry spoke to, we can talk at length about that. It's a national asset. Actually, it's an international asset with the research that's being done there. And there's a lot of state-of-the-art research being done in the labs out at Lackland Air Force Base. Center for the Intrepid, many of you know this. It is a world-class amputee care center, and there's a lot of technology associated with that to make lives better for those amputees. We're all about building partnerships. Everyone in this room is all about that from an industry standpoint. Together we are stronger, being mindful of intellectual property, but we do partner with the other services, the VA, and this evolving entity called the Defense Health Agency. What's important for those that are new to the DoD space is that the Defense Health Agency stood up after the last BRAC, base realignment legislation, and it is responsible for acquisition and logistics and the research piece for all of DoD, which is significant. The collaborations we talked about, and Arthur, you're part of the foundation for our university. Certainly, we have partners at UTSA. Right now, up at UTSA is a 2-day regenerative medicine conference going on with world-class researchers looking at regenerative medicine, stem cell research, and so forth. We partner with BioMed, it was touched on. Dr. Patterson, who spoke the other night, world-class level 4 bio research for the nation. That Ebola research that's being done there has saved lives in Liberia. And right now, we can talk about that as well, the Zika virus. There's always an emerging infectious disease that has to be tended to, and you have to have the science behind it. And then we have our industry partners with Southwest Research Institute. So we could talk at length about each one of those partners, but it is all about synergy and partnering. And a lot of this transitions into that commercialization piece for Jerry and men and women like Jerry and their company. So I'll turn it over to Jerry.
Yeah, this is great. We have a few slides here kind of showing our technology. Before I jump into this, when I was at all these elements that you've brought up, it's interesting because I played roles at some of these places. And so when I first started over at TSRL, it was actually at Brooks City Base. That's when we first got started, and then we moved to that new facility, which is actually very nice. It was a considerable upgrade. But I served as a program manager for the Small Business Innovation Research Program. And that's a very valuable program, and given the high density of really high-end researchers we have and the resources in this city, it's a very unique place. And so the SBIR program essentially allows small businesses that want to compete and develop a new product. They can submit a proposal and get funding to develop a new product that they would normally not have the resources to develop. And the government then invests in these phase 1 and phase 2 proposals to make new technologies. And now this small business and the idea there is it stimulates the economy in local spots, as in particular in the tech space, where then, we just recently received one. We applied, there's I think 60 companies competed for, and we got the award, which is fantastic and quite humbling for the hearing aid. But that allows us now to hire more, engineers and scientists to make that product, and it's a true kind of partnership to bring that to life. And so I got a taste of it on the other side of the table there at the Air Force Research Lab, but I think it's something to bring up because it's an interesting bridge between a university professor that comes up with an idea. They can write an STTR, SBIR, where they can work with a company and the government, and everyone's kind of involved, which is an interesting interface.
And it's also in your work, the shift from something Byron mentioned last night, which is the shift from healthcare to health. Mm-hmm. And that so much of this complex is rightfully so dedicated to things that have already affected us, right? Burns and diseases, but also increasing attention paid to preventing disease and to remaining healthy. And that's certainly where you're focused today.
Exactly.
Do you want to jump into your, I'm sorry, go ahead.
Yeah.
Do you have other slides, or is that it?
Oh, yeah, and I can address kind of,
okay.
But yeah, I'll definitely talk about that a little bit. So, treating health and wellness rather than treating disease. And at Wiseware, that's what we're trying to do, is looking at prevention and before diagnosis and treatment. Historically, our healthcare system has been focused on diagnosis and treatment, and if we move earlier down the pipeline with health and wellness devices, with techniques to keep us healthy, we describe it as fingers, forks, and feet. So fingers is not smoking. Feet is moving, fingers, forks, and eating healthy. It's actually from Dr. David Katz. He's one of our partners, Chief Medical Advisor at Wiseware up at Yale Preventive Healthcare. But in his book on chronic diseases and trying to reduce that's kind of what, that's wellness and that's prevention. So that's actually what our devices focus on. So this is a snapshot. I can kind of show you inside. So this is inside Wiseware. So we have a 4,800 square foot headquarters where we develop the devices, from napkin to full development, all in-house, which is really, really fun to dream up these kind of revolutionary devices to help people and then kind of see them come to life right there in front of you. It's very exciting. And actually, Beth and I, we met, though, at Geekdom, right, which is another resource in this city that hasn't really been brought up, but there's a whole group called, it's Geekdom, it's downtown, and it's a co-working space, and I think it was founded by Graham Weston and Lorenzo and Gomez. Yeah. And so that's where that was our first headquarters, was down at Geekdom, and that's where we first met. And that was kind of how we got started, and then we found this facility and have grown from there. But Geekdom's a great place for new startups and new companies to get started, or also partnering with new resources that I think sometimes get overlooked even. And this is one of our devices, and then inside you can see the technology piece which is all custom made. So we have the first fully integrated metal wearables, which actually have full integration, and the antenna, F-type inverted antenna, allows us to resonate and transmit Bluetooth at distance from metal devices. And so those patents we're going to be licensing to other connected home, connected car, connected health and living, because we kind of cracked the code with that. And all of our products, whether it's the hearing aid or these devices, we truly want to fuse fashion with a thread of technology and basically make sensors and electronics disappear. Because we want the data, but we don't want to wear kind of nerdy devices to get it. And so the idea, exactly, yeah.
Where do you see that coming into the forefront today, and is it a better time to be in the preventative area, and what's happening in your world that is going to keep us healthier and avoid cost?
Yeah, there's so many drivers right now to shift from healthcare to health. Whether it's a fiscal driver, you as corporate directors know this. If you're running large organizations with a lot of personnel, you want them to be healthy and well and motivated, and their families to be so they're not having to take off time from work and they're more productive. So there's that driver. And then from a physician standpoint, what Jerry talked to you about being on that left side of prevention is just the way to go. I mean, on a human dimension, it's the way to go, and certainly from a fiscal dimension, that's the way to go. So, for example, I do a half a day of clinic downtown at the Robert Greene, which is a very underserved population, Medicare, Medicaid, CareLink patients. Almost all of them are obese due to the cultural aspects of diet and lack of fitness. They all have diabetes or pre-diabetes, hypertension, and unfortunately there's a fair amount of substance abuse. If we can prevent, all those things that I just rattled off are preventable issues. If we can, Jerry's devices or his colleagues in the future can let me know that I'm a pre-diabetic from months ahead of time, I'm going to be more disciplined, hopefully, about what I'm doing and walking and eating and so forth. Mm-hmm. So this is exciting, and I think it is the future. And we're seeing an explosion in this sector. I mean, there are literally, if you go Google, the number of apps that are health-related are phenomenal. So there's every driver to do this, to shift to the left. And then, unfortunately, Mother Nature's going to throw everybody a curveball or two. There will be disease and there will be illness, chronic illness, that we can more effectively manage to improve quality of life. And that's where the quality of life comes in. So that elderly patient that Jerry talked to about doesn't have that fall and break her hip. It goes on and on. So it's very exciting and very positive. Mm-hmm. Yeah.
And the whole system is shifting, including incentives. Can you talk about a little bit about the incentives for healthcare providers to shift to more of a wellness and less of a fee-for-service model?
Well, I mean, there's a number, and we can talk at length about the Affordable Care Act. I don't know that we're here for that today, but on the other hand, there is every driver to have a new fiscal and payment models and how you're reimbursed, and whether it's a capitated system or not. And we were talking with General Cook last night about boutique medicine. Well, there's every incentive for that physician and his team to keep the Cook family healthy and happy, and in an integrated way, in a proactive way, and that's a very positive spiral. So, mm-hmm. Yeah.
So the whole system of reimbursement and everything is shifting toward rewarding providers for keeping people healthy instead of for providing expensive tests and care after
You're seeing the landscape moving more towards what's called an integrated health system, with primary care interwoven with specialty care in a coordinated way, and we can talk a lot about IT and electronic health records and so forth. The more integration there is, coordination and awareness, you decrease duplicity of testing and inappropriate use of medications. It's from a patient safety standpoint, it's much better, and outcomes are much better. So there's a great focus on outcomes and quality of care. Not that we didn't have that before. I don't want to discount. We have an outstanding nation, and we have an outstanding healthcare system in our nation. We're just talking about taking it to the next level. But there are fiscal drivers that are driving this discussion, and many of you know this in your various corporations. Your CFOs are briefing you on the cost of your healthcare, I'm sure, yes, on a routine basis. Mm-hmm. Jerry, your thoughts?
You know, this is such an exciting time for healthcare. It's, in my mind, it's almost a modernization or digitization of healthcare. Some people even say it's democratization of medicine, mm-hmm, where the power is kind of moving away from the doctors It will be in a different way, but into the patient's consumer healthcare. Where we have at our fingertips, given our connected technologies and the internet, access to information that we didn't have 10 or 15 years ago. We couldn't get to that. And now it's almost you have a doctor in your pocket. And it actually is better to have all that information and armed with that information, and that way it's kind of the mediator. It's the technology, the connected technology allows us to get that information and empower us to be happy, healthy, and productive. It's going to take time, but it's possible now.
Yeah.
If you look at the adoption rate of technologies, the initial cell phone, it took 12.2 years until it was adopted by, technically 25% of the population. You look at the smartphone, it was 2.2 years. And over roughly 70% have 70% of the population has a smartphone, which gives them a constant connectivity both to the internet and potentially to a doctor, which can drive, 24/7 care in real time, which is just amazing to think about. Because rather than going, I kind of describe it, it's like when I was younger, we used to go to Blockbuster and line up, and the crowds were there. If you would have told me that place was going to go out of business, I would have been, seriously, I wouldn't have believed you. But it's a Blockbuster model, and that's kind of showing up to the doctor. And now digitization moved us to a Netflix model. And we're kind of doing that in healthcare, where people don't want to sit and wait in long lines at the healthcare facilities, and they want to take the action so they don't have to do that. So it's interesting time.
Well, I would like to segue a little bit, but it's related. So our military health institute, for our military forces that are deployed around the globe, this discussion is vital. So whether it's telemedicine or remote monitoring or sensing, or giving consultation with a world-class surgeon that's here in San Antonio to infectious disease specialist or something, or globally, is vital for our mission success and also for the well-being of our deployed forces. And when you look at a state like Texas with large distances, to be able to render high-quality care without having to move that patient from Castroville or some really remote site out in Midland or something, it's vital. And so the quality goes up. It's more patient-centered. It's more appropriate care when we have these type of technological adjuncts. Yeah.
So all great, happy news about great technology and the ability to collect data. There's a little bit of a flip side to the data collection, though. Who owns this data? We talked about some colleges having all incoming freshmen wear a Fitbit. Employers are going to that. When you, as a director of a company, have collected data, who owns the data? What do you do with it? How is it stored? Do we want our employers becoming the kind of big brothers that know how many steps we took today and what our pulse ox is at the moment? And if we're stressed, frankly, at this very moment, could even tell if I'm feeling stressed as I'm walking into a meeting. What are the issues related to that about privacy, and where do you see that going?
Well, we could spend hours on this, but there's a very key. There's a critical issue. So one obviously is cybersecurity, data security, to include our medical devices. Before you connect to the net. And just about every technology we have today, whether it's an MRI machine, an ultrasound, it's connecting to some network structure within that hospital system. And so if you want to have a dark side to it, if you're nefarious and you want to abuse that information, so we have to be mindful of that data security. And then you brought up the ethics, the industrial ethics of having information about your employees to that degree of scrutiny and awareness. All those need to be discussed and worked out. And then there are legal ramifications of everything you just talked about. And Jerry, you could probably speak to that.
I'll talk a little bit about, because
sounds like an issue you've thought about already.
Yes, this is. So there's a ton of devices out there that make claims, especially consumer electronics companies, on things that we've assumed are accurate. So I'm going to talk about the input. So the sensors provide the inputs, and then the data and the connections between the data sets, and then protecting the data. So the inputs, actually, if you look at even conventional optical sensing for heart rate detection, they're starting to put this in every device. And me and my entire team, where our backgrounds are in biomedical optics, we knew you can't get accurate data that way. But this isn't advertised. And so many devices out there in the marketplace are saying we measure your heart rate using our optical sensor from your wrist. And at resting heart rate, it may have a 10% error. But when you start working out, it's a 30 to 50% error. I mean, if I sold you a scale that had a 50% error, that's not very good. You know, that's worthless. So there's a ton of technologies out there. From an ethical standpoint, I think it's not fair to be, you know, creating these products that don't have that kind of rigor and making sure the accuracy is good and solid. But this is actually on my blog, so I actually go pretty in detail. But there's a lot of companies struggling in this area because they just want to increase their feature lines, which isn't fair to the consumer. And since it's not regulated, people assume, oh, well, it has heart rate, it has dehydration, it has this. And it's like, yeah, they all don't work. I mean, so it's sad news, and consumers are starting to see that. But if that data is used, you know, garbage in equals garbage out. So if you have this garbage data coming in, and we're starting to look at that and say, look at my stress level, and it's completely inaccurate, that's really dangerous, because then we're going to be making decisions off poor data. So I think the front end is the sensors need to evolve. We're starting to make some progress in that area. But then now, how do you protect that data? And what data do you want to share and what don't you want to share? And whether it's HIPAA compliant and what entities in terms of the electronic medical records, how is that shared? It's complicated. And I think the security item is critical.
Big issues. And so we could talk about this one all day, but I'm going to transition to your transitions, because both of these gentlemen have made interesting career transitions, and they have lessons from prior fields that translate to the new ones. So, Byron, can you tell us sort of your observations about transitioning from the military into the civilian world, into a public institution, and what have you taken from one to the other that is of interest to us?
Well, as Beth mentioned, I had 38 years, 42 with the Academy in the Air Force, which is a very health-focused, to state it obviously, force. All the services are, with a focus on wellness, integrated care, and prevention. And you know, fitness is right there, the family dimension is there, our healthcare systems function in that capacity, and so that's my background. Well, I shifted a year and a half ago to an academic health center, University of Texas Health Science Center, which is a premier organization, a very, very high-performing organization as well. But it is a different culture, and I have to respect that, and I do respect that. You have professionals that have come up in an academic chain, just as Jerry, in your space, I'm sure there have been men and women professionals that have come up in that industry space their entire career. So you're navigating that, but you're also, and you brought on board to drive change. And it gets back to a leadership dimension of driving positive change in a metered way, that you're moving the ball down the field, but you're not disrespectful in any way to your colleagues that have been there for some time. So that's where I'm navigating that space right now. But what I have learned, it is all about teaming, and that's why we're here this morning, is that collaboration. All those partners up there, I didn't bring it up, but we have a new chancellor for the UT system, Admiral McCraven. And he has a great focus on increasing the synergy across the broader UT system, which is a powerful university system. And I'm on a working group with that team. So there are teams of teams, concentric here in San Antonio, across the state of Texas, and then nationally and even internationally. We have to, that's another thing. In our world today, we need to be thinking internationally in everything we do. And many of you are on corporate boards that have partners around this globe, so you have to be mindful of that international landscape. And certainly, in our military health space, I have to be very mindful of that. The Zika virus is a great example of that. And we're a series of emails yesterday dialoguing about what we're going to do here as an academic community to help support that response. But that's just an example of where we are. That's a long answer to a short question.
No, it's a great question. You know, we have so much military talent here, and when people are looking out for leaders in an organization, a military leader is often a very attractive potential candidate. Are there things that you'd like these folks to know about bringing in a military leader? Have you learned something that they'd want to know? Was the transition just seamless and it's not an issue?
No, I had the good fortune, and there were several generals that had been at the UT Health Science Center and moved on for positive reasons in the years past. So I really sought their counsel, but I've been very fortunate at the University of Texas to have really quality mentors permanent professors, professionals from all the disciplines, to include the health sciences and engineers. And we have good community partners at San Antonio Medical Foundation that have been mentors. So it's a nice team, but I do more active listening than talking. And I have to be mindful of that in that first year of the maiden voyage of this institute, that not perceived as a takeover, but more as an accelerator, a catalyst, an advocate for the enterprises that are already taking place within the university and the broader San Antonio area.
Word on the street is that you've blended nicely over there, and they're glad they picked you. So it's worked well.
I'll have to send you a Christmas card now.
Very good. So Jerry, Jerry gave me an answer to a question that I think you'll appreciate. I asked him at a previous speaking engagement when he decided it was time to quit his other job and devote himself full-time to the thing that was in his garage. And he said, when I had $500,000 of other people's money, I really thought that I should take it seriously. I hope you'll appreciate that answer. Why don't you tell us about that transition?
You know, that transition was probably the most difficult transition for me, because juggling, a full-time effort, the government was aware that I wanted to start this business, so I started the business, and I was running that full-time, the full-time terahertz sensing lab. Wiseware was moving, and I was finishing an MBA. And that was a little busy with a wife and 3 kids. So I was very busy, and then after we raised the first $500,000 that week, then I said, you know what, I need to be a good steward of this money, and I just need to go full-time now. And so I resigned, and it was interesting. I mean, it was a huge transition, because you're going from the government to high-tech startup, and I think the speed, momentum equals mass times velocity. Right? And so when your mass is really tiny, your velocity needs to go up. And so in the startup setting, it was awesome. I mean, because I love that pace, and doing 90 hours a week there, completely focused on innovation and developing the products, was awesome. And then as we kept moving along, though, I'm not very structured, clearly. Right? And so very entrepreneurial, find the right partners, get the team, I just run and gun. And then I brought in our chief operating officer, who was a Marine. He was a director at AT&T, very controlled, Six Sigma and all kinds of dashboards that I don't really look at very often to keep things organized. But he's very structured. It's like the yin and the yang, and he keeps everything moving along. But I needed that, and our team needed that. And his background, that kind of structure, was exactly what we needed. And it's interesting, because each of the different players involved, and we have a lot of researchers that are from either academic settings or from the government, and their depth of expertise that they bring to the table and then develop is important, and it's all like secrets. But I mean, going from academic, up at Vanderbilt in research, to the DoD, to a startup, it's been an interesting, very different environments. I personally like this environment a lot, because I like to create products, that can help people and work really quickly, and innovating and doing that. But then there's also advantages in the academic setting in the DoD, where some of the research and clinical testing, and they provide value that's you can't do in a startup setting, and so each has its strength. And if you have that synergy, you can really create amazing things.
Mm-hmm. Yes.
I have a question for Jerry. Are you at a point now where do you have a board of advisors, or do you have a board of directors with your company? And if so, how do you use them? If not, how would you use them?
Great question. Yes, so we have, there's 2 directors on our board of directors. Dr. Edward Leahy, he is actually an interventional cardiologist and a serial medical device entrepreneur. So he's from Houston. He was one of our lead investors as well. I talk to him every day. And then we also have another board member, Miss Lisa Corliss from Blue Cross Blue Shield. And she's very experienced in the insurance. She's an insurance executive. And I actually met her during the MBA. And I talk to her probably a couple times a week. And then we have board meetings, formally every quarter. We have other advisors, business advisors, and technical advisors, retail advisors, design advisors that also are part of that.
But that's a really good question to talk about. That kind of getting counsel, whether it's directly a board of directors or not. And you're, Byron, involved at that level, and then you also have a board of regents. Can you tell us about that relationship and
Certainly.
you
I
deal with
report
that?
to our president, Dr. Henrich, and he, in turn, the chancellor and the board of regents. But we have an external advisory committee, too. When I stood this institute up a year ago, the first thing I did was I made sure it wasn't a Byron Hepburn Institute. It was a UT Health Science Center Institute. And we developed a charter that was vetted with all the schools and the president, and a strategic plan. And part of that strategic plan, it's in an annual cycle of revision, was an external advisory committee with premier advisors, Dr. Gilman from Johns Hopkins, Dr. Jenkins from Mayo, Dr. Porapadich from the University of Pittsburgh. It was Admiral General Scully from the Uniformed Services University. It'll be now General Travis, who was our Army Air Force Surgeon General. So these are premier leaders in military health that will give me counsel. So none of us know it all ourselves. We have to have that sage counsel on an iterative basis. Good question. So in this academic space, I think it's just as vital as it is in an industry space to have that ongoing counsel on a cyclical basis.
So you both work in settings now where you are bringing together diverse groups of people. Both of your settings defy the creation of silos. How do you deal with a mobile workforce, and how do you bring people in? You're trying to cross military and civilian. What are the issues there, Jerry? We know you have plenty to add to this too. Byron, why don't you start with that?
As far as a mobility of the workforce?
Yes.
Well, in the academic space, it is all about collaboration. So somebody touched on the center we have at the university for the Consortium to Alleviate PTSD, CAP, Strong Start. And that's a team of teams, 30 universities around the United States, to include one Canadian partner. So it is about collaboration. And so the intellectual property is bouncing around virtually and physically. There is still a value in bringing a synergy of physical presence. Mm-hmm. Jerry's core team's an example of that, his fellow PhDs together. You have to do that. And so every high-performing university has that as a goal, is bringing new leadership on board, new intellectuals on board to drive this forward movement. And so I've already been told by my president and the dean of the medical school, one of my job jar responsibilities is to go out there and seek high-performing talent. Dr. Jenkins is a great example of that. We're bringing him down from Mayo Clinic, a premier trauma surgeon, highly regarded internationally. He'll be my associate deputy director here this summer. But so I'm very mindful of the international and national landscape and bringing that intellectual property capability here to San Antonio to build our institute and our university and our activity intersection with industry.
So we talk a lot about collaboration, and sometimes what we're calling collaboration is really a big pot just divided into smaller sectors and everybody gets a piece. Is there real collaboration, and what are the barriers, and where are you seeing success?
Well, in academia, you have to, just as an industry, you have to be mindful. There's a food chain of growing up to be a tenured professor, and you have to be responsible who the principal investigator is, and Jerry can speak to that, whose name is first on the publication and everything, and I'm mindful of that, that academic professional development. But that said, you can still be the second or third author on a scientific paper and move up professionally. And so, but you have to be mindful of all that. And don't I don't trivialize it in any way, just as an industry has their intellectual property that they need to move forward for in a profit standpoint.
And we heard the other night at our event about, our other event that was mentioned earlier, about trying to open the doors to really partner with industry. That prohibition, for example, in the past about letting outsiders use equipment or be in your labs or that kind of thing. Are those barriers breaking down, and where are the opportunities for industry to really connect with public sector agencies that do so much research?
Yeah, we talked about this last night. There's every intent on the Department of Defense to accelerate the transition of new devices and therapeutics to get them to the warfighter very quickly as safely as possible. And Jerry's point earlier about the quality and safety has to be mindful. We want to go fast, but sometimes an old instructor pilot, when you're in a hurry, slow down a little bit. Particularly when you're talking about patient safety and outcomes. You can do a lot of harm by having a device that's not validated or the science is not there. And so we have to be moving forward at a fast pace, but also validating it with milestones so that we're doing the right thing for our patients. And in a military perspective, operational success. So we're mindful of that. But the DoD really is doing everything we can to accelerate this transition. And there's some great examples here in San Antonio. We talked about them last night. The interosseous nail, the wound vac. We're testing therapeutics right now for hemorrhage control that we learned about in the operational environment over in Iraq and Afghanistan. They're going to save lives for our citizens here in the future. So we're moving forward at a very brisk pace, but with due diligence is how I would describe it. Yes?
Can I take the question she asked just a little bit broader?
Yes.
I don't have a medical, scientific, or engineering background, so help me phrase the question if I could tackle it. You know, from a layperson standpoint, you're seeing huge advancements like in computing power and cross-fertilizing like technology with science. And then you have Obama saying, now we're going to throw a lot of money out there from the government. I'm not in favor of this to cure cancer. What's really preventing the really efficient collaboration between the private sector, academia, the military, here in the United States and even globally, to really crack things like cancer and Alzheimer's? What are the things that aren't working that could work better? Obviously, the private sector wants to make money, so they want to get IP around it and monopolize the use of that to create value for their shareholders. But at some level, to me, as an outsider, this could be working a lot better. So what are the things that could really be fixed to kind of get a win-win for the military, the scientific community, the private sector, to crack some of this stuff? My sense is it's all so screwed up that nothing gets done. And we're farther behind than we could be if somebody could take a hold of this and run this more efficiently.
Well, I don't want to discount the incredible advances that have been made in science over the last 20 years. The National Cancer Institute, you look at MD Anderson and what they've done. There are people in this, people living today that 20 years ago, children and adults. Our president is one of them, and openly known, bone marrow transplant, and he's alive today. Children with leukemias. So I think we have made incredible progress, but we're dealing with complex issues. When you talk about cancer, it's not one label. You're talking about thousands of subordinate types of biology there. And so, but you're right, these are complex issues with complex organizations, and there's always opportunity for improvement from a policy perspective, from an organizational perspective. And getting back to the DoD piece, there's every awareness that that interface with industry needs to be improved. In fact, the DoD just stood up what's called MTech, Medical Technology Enterprise Consortium. It's led out of Charleston, South Carolina. It's going to be served as the vehicle to expedite what we're just talking about. And we have our Office of Technology Commercialization looking at the legalities of this, the IP parts of this, because there's a legal and fiscal dimension to this discussion. But I think there's always opportunities for improvement. I don't want to discount your question. But I think we ought to be very proud of what this country has done to date. But there's always improvement for the National Institute of Health. And your point's taken. I think this insinuated that throwing money at things oftentimes doesn't always solve the problem. There has to be the thoughtful leadership and the direction and the guidance and focus. Jerry, your thoughts?
It's a great question. I'd love to add a little story here, because some of the innovations and breakthroughs we've had in the last maybe 5 or 10 years, even in the biomedical and medical space, have been unbelievable. I mean, mind-blowing and game-changing. I mean, truthfully. So when I was in the 7th grade, I learned DNA consisted of 2 parts, intron and exon. All right, an exon, a tiny percent, a few percent, and an exon made the proteins. And the introns, I memorized, is just in the way kind of barrier DNA to protect the rest of the stuff that's important. And even when I was a kid, I was like, that's weird. Only 2% or 1%, a tiny percent, the exons make the stuff that is important, the proteins. Well, a few years ago, Fire and Mello at MIT and Stanford, they got a Nobel Prize for discovering that, guess what? The intron makes stuff that's very important. That's actually, if you look at how a protein's translated, the messenger RNA goes into the ribosome and then it makes a protein. Well, there's these things called microRNA and siRNA that are made from the intron, which then can go and serve as the braking system on protein production, which then kind of is the offense and the defense to balance what's going on inside the cell. So I give that example because it's pretty incredible what's going on, where our understanding of cells and genetic profiles is improving exponentially every year. In particular with genome scanning and in some of the work that we're doing where we're doing high throughput deep sequencing, where for cancer in particular, I know that was beyond cancer, the question, but in cancer in particular, if I have a certain type of cancer and we take a sample and we run it, we can get exact genetic profiles, even protein expression profiles, and say, okay, now, and we're just getting there, this is Jerry Wilmink's profile. Now, on the first 100 patients that had this particular exact type of cancer, their profile was this. This treatment, now personalizing it, worked very effective in this group, but not when they had this profile, which is like Jerry. So we shouldn't give them this treatment. That personalization, this P4 that you had mentioned, personalized, participatory, preventative, and that proactive, that kind of engagement is going to make over the next 5-10 years, we will have personalized cancer treatments that are going to, very specialized and individualized, that will be very effective.
I got a question. I'll go back to that data question about who owns it. I founded and own a sports performance and wellness company in the Woodlands, and the wearables and the technology, there's no shortage of data for people who want to set goals and track activity. But the platform of where we can take this, everybody in here probably has, if you took a poll, Garmin, Fitbit, Apple, what's the platform that's going to win out where you have a single place where you can take and put all the data so you can make sense of it as either a consumer or an executive of a business, right, where you want to manage this? There's got to be one repository for the data to be analyzed. I'm just sort of curious, is it going to be the cell phone companies? Is it going to be the operator? Who's going to end up winning that platform battle?
Wiseware.
Yeah. Well, yeah, that would be great. No, but I think Apple Health Kit, they're trying to make a play in this, where they're kind of the master API integrator of some different types of data. Google Fit is doing. They're one of the big players, and Under Armour actually has been acquiring. I can't keep track, but 2 or 3 pretty big, MapMyFitness and others for $500 million to kind of, pick up the pace in terms of API and software integration for all these different inputs. So there's people making big bets in that space. The Validic is doing a lot of integration with surrounding kind of inputs, and it's tricky. It's tricky, and but the health and wellness providers, they want it to be open. We put ours through Google Fit, so it can go on a dashboard, but we make our own dashboard as well, that other products can, basically import data into our dashboard, but it's difficult, and I think we've just touched the surface in that area too, though.
Well, where it gets very interesting, though, is when these devices start becoming part of the therapeutic regimen. So I'm actually prescribing Jerry's device for my heart failure patient. So then you get into the HIPAA requirements, and the data security goes to a next level. It's almost like an Air Force security level. It has to. And so that has to be all tended to, and it needs to be part of the broader National Health Information Network discussion that's taking place. So individuals like you need to be part of that dialogue in Washington and at the state level too.
Yeah, that's clearly a case of where the data exists and we don't have the regulations around it. When does data on how many steps you took today become health data and now subject to
particularly
HIPAA
given
rules?
what Jerry and his colleagues are developing, it's quickly becoming part of that. It should be part of that health record. Yeah.
Mm-hmm. Julie, are we good on time? We have one more question, or are we ready to go? Or we have a couple more questions. One more question. All right, gentlemen, you want to wrap up with a sentence or two about last thing you'd like these folks to know about what you do, or?
No, I would just say that we started with the excitement, and it really is let's focus on the positive and good. There are challenges, there's no question, that's part of leadership, is tackling challenges in an integrated way, in a proactive way, but San Antonio is an awesome space, and our partners across the state of Texas are part of that. The international piece as well as national piece is vital, but the industry, academic, and operational in the sense of military synergy is vital, and I always remind my team, in our case, there's a patient at the end of the discussion. Don't lose sight of that. Mm-hmm. And there's a wounded warrior, hopefully one that we're going to bring back and restore to optimal functioning in his children. So I always get to why in life. That's why I get up every morning. And I'm very mindful of the fiscal stewardship I'm responsible for, but I'm also mindful of why I'm doing what I'm doing. Thank you.
And you, the chief of Wise Ass, you have the last word. This seems appropriate.
I want to thank the organizers, because honestly, this is part of the solution right here, though, is getting us together, the leaders in the community, directors, and having inputs and dialogue so we can figure out what do we need to do. And we took the action to get here early. As I was leaving for work, this is a little earlier for me. I normally do a workout and then I start my day. I was in my suit, and my son Brooks saw me. He's 3 years old, and he said, "Daddy, you have another show and tell today?" And I was like, "Yeah, pretty much." But this is kind of the interface and the dialogue that we need to take action. And I thank everyone that's here and that came, so we can, and thank you, because this is the key, is the interplay between the different parties, and setting up these kind of forums is the crux of the ecosystem. And thank you. And without you, that's when we first got started. I mean, you are the player that puts and orchestrates it and gets the right people in the right rooms, and thank you.
Well, thanks. It's been a pleasure to be here. Thank you.
Let's thank them. Thank our panel. Thank you so much.